Hello, everybody. My name is Kelly Higgins. I am the Executive Director for the Autism Community Connection. Thank you for joining us. A little bit about ACC. We are a small nonprofit here in Johnson County. We serve individuals and families affected by autism. We have our family game night coming up on April 21st. From 6 p.m. to 8 p.m. at the Greenwood Community Center. This is free for anybody who wants to join. You just need to register online. And then we have our My Summer Journey, which is our summer teen program. Registration is open. My Summer Journey will be 3 weeks in June, Monday through Friday from 9 to 4. This is for teens with autism, ages 13 to 19. Registration is open. Go to our website to learn more. So again, I'd like to thank Michele Trivedi for being here today, presenting about health insurance, mental health services. This is a wonderful topic that everyone needs to be aware of and to understand how to navigate it.
Thank you, Kelly. Happy to be here.
Thanks again, and just take it away.
All right, sounds good. Well, thank you everyone who is joining us, and for those of you who are accessing this recording. A lot of times health insurance feels very overwhelming and maybe is not the most fun topic in the world. I completely get that. It was something that I, cared about, but really started to care about when I found out my health insurance company wasn't going to cover my daughter's very expensive ABA therapy program. So completely get that it's something that a lot of times we kind of don't think about until things start to go wrong. So I want to give everybody some general tools and general information to help you understand your policy a little bit better and kind of what policies are out there as you're picking policies when we all go through that open enrollment period with our employer, or when your child gets access to the Medicaid waiver and you have to start looking at Medicaid options, just to give you some information that you can access when you need it and go back to on the website when you need it. And then also some resources as well that the ARC of Indiana has that can help you out. And then just to let you know, the ARC of Indiana is a statewide organization that provides disability advocacy and information for people with developmental and intellectual disabilities, including autism, but all intellectual and developmental disabilities. And the ARC serves people across the lifespan. So we help children from birth until the grave, basically. So we do a lot in the adult services space as well, and helping adults and self-advocates. So just to let you know that the ARC is a resource for across the lifespan for not only self-advocates, but also their families as well. So check out our website, Facebook and socials, and see if there's something that we do that can help you out as well. My name is Michele Trivedi. I am the ARC of Indiana's insurance advocacy person, and got into this basically out of necessity. Like I said, my daughter's insurance was not covering her autism treatment back when she was diagnosed in 2000. She's 25 now, and health insurance is much more accessible than it was back in the day when she was diagnosed. So that's the good news. The bad news is health insurance is really complicated. And a lot of times we're able to access certain things, but we just don't know how. Or sometimes even our employer doesn't understand fully what the policy is supposed to cover, and there are unnecessary barriers to our loved ones getting their coverage. So we're going to talk a little bit about the various, trying to get my slides to advance here. We're going to talk a little bit about the different types of health insurance and some of the basics about the rules. So in order to help your insurance work for you, whether it's Medicaid or whether it's an employer-based insurance, at some point you are paying for it, either directly or indirectly through taxes. And so you want to make sure that it's working for you. And so it's really important to know what type of insurance you have. And you can have Anthem insurance, or you could have Humana insurance, or you can have CareSource insurance, but that's not the type of insurance. That's the insurance carrier. And each carrier may offer several different types of health insurance. So we're going to talk about that to help you understand what that means. So insurance types fall into a few major buckets, as I like to call them. And so one of the first major buckets is employer-based insurance. Most private insurance is somehow employer-based or tied to employers or employment if it's offered by the employer. And so if your employer does offer health insurance, it's going to fall into kind of two main sub-buckets there. Employers are either self-insured, and that is federally regulated under a law called ERISA. Governments love acronyms. So that's the law, federal law, that governs self-insured employers. And basically what that means is the employer themselves is taking the risk for the health care of their employees and their employees' families or dependents. So an insurance carrier may be involved, an Anthem, a Humana, a Cigna may be involved, but they're taking on a role of administrator. They're not taking on the role of risk. And so really the employer at the end of the day makes the ultimate decisions about what's covered, what's not. They have a lot of flexibility about what they can do. And again, like I said, they're regulated by the federal government. So any issues, complaints, problems have to go through the Department of Labor, not our state Department of Insurance. So that's a big difference in terms of if you're having an issue and you want to know who to go to help you solve it. On the other side, we have the fully funded or fully insured employer. That's an employer typically based in Indiana, typically has most of their staff working in Indiana. They would buy insurance off of the Indiana market from a carrier like an Anthem or a Humana, and the carrier is the one that takes the risk for the health-related costs of the employees and the families. So the insurance carrier in this type of insurance is the ultimate decision maker about the policy, what's going to be covered, what's not going to be covered, and they must follow state mandates. So for example, we have an Indiana autism mandate law that I was privileged to help pass back in 2000. And so fully funded plans have to follow our Indiana autism mandate. Self-insured companies don't have to follow state mandates, and there is no federal mandate for autism coverage. However, a lot of self-insured or these ERISA-based employers do cover autism because of federal mental health parity law. And we're going to talk about that in a little bit. But we do, so just so everybody understands, we've got these two main buckets of employer-based insurance, and they are regulated by two different sets of laws. And so depending on which one you have will determine if you're covered under the Indiana autism mandate law or if you're covered under a federal law. And those would be completely different ways of going about the appeals and complaint process. So I hope that makes sense.
I have a quick question.
Yeah,
So let's
absolutely.
say my husband's insurance is through the employer, but the insurance that they have is not Indiana based, it's based in a different state.
Right.
So obviously we live in Indiana, but so the autism mandate would not have to be in effect, or would they not have to have the autism coverage, or how would that work?
How that would work is we kind of get to play 20 questions. So we, first of all, we find out, is this employer federally, is this employer ERISA and self-insured, or is this employer fully funded and bought the insurance off the market in the state where they're headquartered or in the state where they're incorporated? It could be different. So if it turns out that they're ERISA, then we're talking about federal law, and we would look to the regulations and the laws regarding ERISA and autism coverage and mental health parity law. to determine what the coverage should be and if the coverage is in line with what should be expected. Now, if the employer is not based in Indiana, but is fully funded and their insurance is purchased in another state, then we look at that state and what their mandate looks like.
Mhm.
And luckily, as of a couple years ago, all 50 states have a mandate, but they vary. Indiana's is the strongest mandate, and it covers the most services because it covers all medically necessary services. There's no laundry list of services. So if tomorrow the American Academy of Pediatrics or the American Psychological Association says this treatment is medically necessary for autism, then insurers should cover it because they need to follow those guidelines in terms of covering anything that's medically necessary.
Okay.
So that's the benefit to our mandate. But it depends on, if you're covered under a different state, you have to look at their mandate law and what it covers. And if it has limitations, like you can only get 20 hours of ABA therapy, or you can only get 20 visits a year of speech therapy, you would have to look at that.
Okay. Just curious.
Just to make it simpler on everybody.
Right.
Yeah, but that's a great question. And that happens a lot. We're especially with our Hoosiers who live kind of on the cusp of a border. They may live in Indiana and work in Kentucky, or they may live in Indiana and work in Ohio. And so they have to figure out what type of insurance that employer has. Is it that federally regulated insurance in ERISA, or is it fully funded? And then which state is it fully funded in? So,
Right. All right.
Yeah.
Thank you.
Sure. That's a great question. Then some of the other buckets that insurance can come into is some of the ones that I have listed here. We see a lot of union plans in our state and a lot of small government entity plans in our state. They're kind of different animals. The union trust funds kind of have their own rules. It depends on what was negotiated with the employer and with the union. So then we have to have an advocate look at the specific terms of that union policy and also involve union personnel to help us understand what the coverage is and what's available through that. In terms of small government entities, some of them are self-insured. Some of them are fully funded. Some are able to opt out of federal mental health parity law, and so then don't cover autism. So again, if you work for a small government entity like a city or a county, you really have to dig into that policy and look at what its terms are, and if it's opted out of or been allowed to opt out of federal mental health parity law, so that you can determine what type of coverage is available for mental health and what type of coverage is available for autism. Church-based plans. Church-based plans became popular, especially during the Trump administration. And so they can be wonderful avenues for lower cost health insurance, but they aren't really health insurance. So they don't have to follow any mandates or any of the typical insurance regulations that health insurance plans do. And they are able to determine what they want to cover and what they don't want to cover without having to comply with a lot of regulations. So they may or may not cover autism, and they may or may not, even if they do, they may or may not cover the full complement of treatments that are available based on just what they've determined they're going to cover. And cost is certainly going to be a big factor in that. And also whether or not the treatment is perceived to comply with the religious beliefs of the organization is also going to come into play with that. So you have to be very, very careful from a coverage perspective, signing up for a church-based plan when you have a loved one with special needs or mental health condition, because the coverage is likely to be pretty low and may be very difficult to access. So just kind of a word of caution with that. The FEHB, that's the Federal Employees Health Benefit Plan. And as of, I'm not going to remember the exact date, but for the last few years now, they have been required to cover autism. and autism treatment. And so that was, advocates did a great job nationally of fighting for that. And so that has, been, that coverage has been in place for a couple years now. So that's wonderful. Quote unquote, short-term health insurance plans, those also became very popular and promoted a lot more during the Trump administration as kind of a way to reduce healthcare costs. And they are lower cost premiums than a longer term health insurance plan, but you get what you pay for. There's a reason for that. These short-term plans were never designed to cover someone for a full year or for 18 months or for 2 years. They originally came to be to help people just get through a couple months in between jobs. So their entire structure is not there to support people with chronic conditions, because they're supposed to be very short term, just a couple months kind of policies, even though you can keep them for up to 18 months in some states. So their coverage for anything is going to be very sparse. And there's a lot of surprise billing problems with these plans, because on the surface, they look like they cover, for example, hospitalization, but then in the fine print, they don't cover this part of hospitalization and that part of hospitalization and this part of hospitalization. And so then people end up with tens of thousands of dollars in bills, thinking they had health insurance coverage under these short-term plans. So be very, very cautious in getting those types of plans if anyone in your family has any kind of chronic physical or mental health condition, or if you're going to use it for anything other than just getting through a month or two in between jobs when you can get on a different type of employer plan. Then the other big bucket that most of us are familiar with in terms of insurance is the publicly funded insurance. So employer-based insurance is private. Our publicly funded insurance here that we're going to talk about is Medicare and Medicaid, basically. So they're publicly funded, taxpayer funded, and they are federally regulated. Medicaid is a little bit different in that it's both federally and state regulated, and states have a decent amount of leeway in how they administer the program. So because you access, if you move to Indiana, or if you move out of Indiana, just because you were able to access certain things in Iowa under Medicaid does not mean that you necessarily can access it in Indiana or Ohio or Massachusetts. It really depends on what the state plan for Medicaid looks like and what they've put in their state plan. So unfortunately, Medicaid is not this nationwide transferable type coverage. If you move from state to state, there will be, in some cases, some fairly stark differences in what services are available. So just, to be aware of that if a move or something like that is a possibility for your family in the future, you'll definitely want to investigate where you're going and what services are available under their state plan. Medicare, some of our loved ones become Medicare eligible especially if you have an adult child with a disability, they become Medicare eligible when the parent retires or the main caregiver retires. And so we do have several of our adults loved ones on both Medicare and Medicaid. And so then those benefits have to be coordinated. And there's actually a whole state entity that helps people in Indiana coordinate their Medicare coverage and their Medicaid coverage. So if that is something that you need assistance with for an adult child with a disability, please contact the ARC and we can put you in contact with their assistants, who are basically, it's their job to help you coordinate those benefits together, because both systems are kind of complicated. And so they are there to help. And it's wonderful that we have that in our state to help people navigate those two things. Okay, and then lastly, the big bucket for our community that's very important are the Affordable Care Act marketplace plans. These are sometimes known as the Obamacare plans or the ACA plans. And so they were very beneficial for our community for a couple of reasons. They require coverage for our autism mandate law because of the timing of this law and because of the way that Indiana picked its essential health benefits plan baseline. And the other thing that is extremely helpful for our community is that the Affordable Care Act law opened up federal mental health parity law to many more types of employers. So if the Affordable Care Act goes away, a lot of our mental health coverage goes away, because before the Affordable Care Act, only very large employers were required to cover mental health and were required to offer parity to mental health coverage. So with mental health parity law in place through the Affordable Care Act to cover mid-sized employers and smaller employers, that opened up coverage for equal mental health coverage to many, many, many more people. And so if the Affordable Care Act goes away, that coverage goes away unless it is specifically replaced. And so far, none of the bills that have tried to repeal the Affordable Care Act have had any kind of replacement for that coverage in them. And so it's been very difficult on the advocacy side because we don't want our community to lose that coverage that they have grown used to over the last 10, 15 years. So the other benefit with the Affordable Care Act is that a lot of employers don't offer insurance. And, or if you're like me, self-employed and a contractor, there's no employer to offer insurance. And so the Affordable Care Act gives everyone an opportunity to purchase a health plan with some of the advantages of being part of a big group. Health insurance becomes cheaper the more people that are on it. And so that's kind of the way it works. The more people that pay into it, the more people that get on it, the cheaper it becomes, because then the risk gets spread out among all of those people. So the Affordable Care Act has given self-employed people and people who are not offered insurance through their work. They may be seasonal workers, they may be workers whose companies aren't large enough to offer insurance or don't have to offer insurance. And so this gives them access to health insurance for not only physical needs, but also mental health needs, which is really important. Different carriers in the state run our Affordable Care Act marketplace plans. So you'll see like CareSource, MHS, Better, Anthem. I believe United Healthcare does now as well. So there'll be several different carriers offering this Affordable Care Act marketplace plans, depending on the county that you live in. So the healthcare.gov website is a good resource to find out from your county, Johnson County, who is offering plans here, what do they cover? And you can also find someone who's called a navigator on that healthcare.gov website, who is local to your county and who knows the carriers in your county and who knows the providers in your county, knows the hospital system in your county, and can kind of be a coach and help you sign up and help you understand what services are available and who's in network and who's not in network and all of those good things. Because healthcare is very local. So having those local navigators who know the healthcare around you in your backyard are really helpful to, if this is something that you need and need to sign up for, they're very helpful to help you pick a plan that really works for you. A lot of our families have gotten on what's called Silver Affordable Care Act marketplace plans to help access ABA therapy and other types of autism therapy that maybe were not covered under their employer insurance and have put their children on an individual plan on the Affordable Care Act marketplace if their employer coverage did not cover autism. So that is an option as well if you're finding that you have one of those employer plans that, just for some reason does not have to cover mental health, does not have to cover autism, and is not going to. This could be an option. Okay. Then a lot of our loved ones are on the the Medicaid waiver. And so especially children, although adults as well, you may have a situation where your child is on both an employer plan and Medicaid. And so what has to happen is those two things need to coordinate. So just understand Medicaid is always the payer of last resort. So for example, even though my daughter's 25, she's still on my husband's insurance. And so that's her primary or her first insurance. That's the insurance that gets billed first. And then she's on Medicaid with the waiver. So that Medicaid health insurance piece that comes with the waiver, that is the payer of last resort. So they would be billed after her employer-based primary insurance is billed, and then Medicaid pays the copays, deductibles, coinsurance for any services that Medicaid authorizes and that Medicaid pays for. So that's important to know as well, because they will pay those copays, deductibles, and coinsurances, but it does have to be a service that Medicaid covers. And Medicaid does cover ABA and does cover speech therapy, occupational therapy. So a lot of those things you'll get assistance with those out-of-pocket costs that an employer-based insurance would not be covering. The other thing to understand is that the employer-based insurance authorization for any services has to be exhausted first, and then Medicaid would get billed for visits or services that the employer-based insurance doesn't cover. And so your providers should understand how to bill that, but just to kind of give you some basic understanding of why the employer has to get billed, the employer-based insurance has to get billed first, and then Medicaid gets billed after that. The other thing that I want to make sure that families understand with Medicaid is that you are not supposed to be balance billed when you're on Medicaid. That is part of the Medicaid provider contract. So they should not, an ABA provider or a speech provider or a therapy provider should not be sending you a bill for services that could be billed to Medicaid. And the only way for them to be able to do that is if before every date of service, they give you a waiver where they explain that it might not be covered, why it might not be covered, how much it's going to be, and then you agree before services are rendered that you will pay for that service because it is not going to be covered by Medicaid. So I hope that makes sense. Because really Medicaid recipients should not be balance billed for services that could be covered under Medicaid.
So is this just for ABA therapies per se, or can this be like for doctor visits as well?
Excuse me. This is for any service. Any service under Medicaid health insurance that is that you should not be balance billed for that copay, coinsurance, deductible, or things that weren't covered. Those should be pre-authorized first. So they shouldn't be providing you a service that they haven't pre-authorized and might not get covered. Mm-hmm. And then secondly, once the service is provided, they should not come back and say, Medicaid didn't pay for these 3 dates of service, so now we're going to balance bill you for those. Okay. They need to the provider has to pre-authorize that first. They have to bill whatever employer or other type insurance may pay first. Mm-hmm. Then they bill Medicaid, and then whatever Medicaid covers, they should take that as payment in full. Okay. The only time that they can get a waiver to ask a Medicaid recipient to pay for services is if it's not a covered service by Medicaid, and then they go through this process of getting this waiver first. Before any services are rendered and for every date of service. Okay. So they can't have you sign a waiver that says, for the next year, I'm going to pay for whatever Medicaid doesn't cover. Mm-hmm. No. They can say, tomorrow, we're going to provide you with this many hours of ABA therapy, or an hour of speech therapy, or this dental procedure. We've tried to pre-authorize it. Medicaid is not going to cover it. It's not a Medicaid coverable service. Do you still want it, and will you pay for it? And it's going to be this much money.
Okay.
That's the only time that they can ask a recipient to pay under Medicaid. And that is part of their provider contract, and they should know that, but sometimes they don't.
And what about like hospitalization stays and stuff? Does that go towards those as well? Or is that something different?
Hospitalization should be covered under Medicaid. And so there should not be a balance bill situation there either, unless upfront they let you know that, this part of the hospitalization just isn't a Medicaid covered service.
Okay.
And so it's going to be this much, and do you still want it?
Okay.
Yeah.
I was just curious.
No, that's a great question. You basically, kind of bottom line, you should never get a surprise bill in the mail
Right.
for a paid service or from a Medicaid provider, because they're supposed to go through this. First, they're supposed to go through pre-authorization and make sure that it's going to get covered. And they should be also checking eligibility before every data service as well, to make sure that there's no eligibility issue. And then they're supposed to be doing that before services are rendered. So they should find out before services are rendered, oh, there might be some things here that aren't going to be covered. Now let's have that conversation. Do you still want it? This is exactly how much it's going to cost. And then you decide. But you should just get some bill in the mail that says, oh, hey, this didn't get covered, and now you have to pay for it.
Okay. Sounds good. All right. Thank you.
Sure. Again, they got to make it easy,
Yeah.
Then one other thing to go over as well is, with the Affordable Care Act marketplace plans and Medicaid, it is possible for a child to have both. If they are on a waiver because of disability. So they can't have both if it's a situation of eligibility for low income. But if a child is only eligible for Medicaid because of a disability, they are able to have both an Affordable Care Act marketplace plan and Medicaid through the waiver, such as like a child only plan. And so then they would have both, and the Affordable Care Act marketplace plan would be the primary. That would be billed first, and then Medicaid, always payer of last resort, that would be billed second. And families may do this for a variety of reasons, but it is possible. It was a lot more popular several years ago, when a lot of employers still weren't covering autism. So, again, it is a possibility if it's your one way to get coverage for your child for autism treatment. But one thing to keep in mind, if you do want to use both of these types of plans, is that the Affordable Care Act marketplace plan cannot be subsidized for that child. So, for example, if you have a family of 4 and you're self-employed and you put the entire family on the Affordable Care Act marketplace plan, you can do that, including your child with autism. But if your child with autism also has a Medicaid waiver and Medicaid, then that child can't get a subsidy. You have to pay the full ACA marketplace price for that child, or else it'll be charged back to you on your taxes through the IRS. And so some people got surprised by that after taking the subsidy for a year, and then when tax time rolled around, like, oops, nope, you can't do that. And then they had to pay that extra funds all at once. And so, no one likes surprises with the monthly bills. So just to keep that in mind. And some navigators are not aware of this. So I want to make sure that families are aware of it, so that they can ask the right questions, and also ask if they're talking to a navigator and the navigator says, oh no, you can't have your child on both Medicaid and this. If it's Medicaid through disability waiver, it's okay. If it's Medicaid because of low income, then you can't do it that way. You have to be on Medicaid. So I hope that makes sense. Kelly, did that make sense?
Yes.
Okay,
Yes.
good.
I think Crystal has a question for you.
Yeah.
They want to know, is there a loophole somewhere for private insurance that is self-funded that keeps denying all autism fees?
There can be, yes. There's a couple different ways that there could be loopholes. The main loophole, if a self-funded or a self-insured employer plan is denying autism services, you have to look at if they offer mental health services. If they offer mental health services, then they should be covering autism. It may not be on par with how other plans cover autism, but there should not be a blanket denial of any treatment. So the first thing I would look at in terms of looking at that policy is to see if they're covering mental health care. If they're covering mental health care, then they should be covering autism, because autism is part of what's called the DSM, which is basically the manual of all the mental health diagnoses. And the way that law is written is it's supposed to cover most of the mental health diagnoses in the DSM, except for some very targeted ones that were carved out, but autism is not one of those. So it should be covered if they're covering mental health. So that would be the first thing I would look at. The second thing that I've seen is they're supposed to cover mental health, but because they don't want to cover autism, they categorize autism as something else. But you can't just make up a category for autism so you don't have to cover it. It's a mental health under our current system. It's a mental health diagnosis. It's in the DSM-5. It should be covered under mental health parity law. So a lot of times that's an education issue, and just educating the employer that, there are some issues here with mental health parity law that we need to look at, and that we need to investigate why this coverage is being written this way. And most times, once the employer is educated, they're like, oh, okay, but yep, let's talk to our carrier and let's get this figured out. And some dig in their heels, and then everything in between. So, so that would be the kind of the second question to ask. The third kind of big loophole that I've seen with self-insured plans is they'll say, yes, we cover autism, but we only cover psychology visits, psychiatry visits, some speech therapy, some occupational therapy, but we don't cover ABA because that's educational. That is a decades old argument that has been refuted time and time again. Again, that's an education issue, and making the employer aware that, no, it's ABA has been considered to be the gold standard of autism treatment, especially in early intervention, for decades, and approved by all these different medical societies and all of that. And so it takes some education to make that happen. So those would be the three top things I would say to look for in the policy. When they do deny those services, they should be putting in the denial letter exactly why they're denying them. So I would look for some key terms like, we don't have to comply with federal mental health parity law, or that is experimental or educational, or that is not a covered diagnosis. That would say to me, maybe they cover mental health parity, but they're carving out or trying to carve out autism and put it into some kind of made up category for the purposes of not covering. So that would be my three top educated guesses as to what might be going on there. So I hope that helps.
Crystal, do you have any other questions for that? All right, she said thanks. I'll look into it.
Okay. Yeah, it's unfortunately can be maddening, and it's like going through a maze. But those would be the three things that I would look for. Then the other thing I wanted to make sure that families are aware of, another benefit from the Affordable Care Act for our community, well, for a lot of people, but especially for our community, children can stay on your plan until age 26. So that can be very helpful to help keep your child covered and to keep them in the therapy programs that they're doing until age 26. There are no age caps that are allowed on as a determining factor of allowing therapy. So there's no age caps on ABA in Indiana and Indiana-based plans or an Affordable Care Act plans that are purchased in Indiana. Mental health parity law should not allow age caps on ABA therapy or autism treatment either as like a sole determining factor, because they're not put on physical conditions generally. So that's something to keep in mind. Now with the Affordable Care Act, non-disabled children then have to move off their parents' or guardians employer plan when they turn 26. With the Social Security Act coupled with this Affordable Care Act law, a disabled adult child, which isn't very person first, but that's the technical term, a DAC or a DAC, disabled adult child, in many cases, and I would say in most cases, is allowed to stay on their parents' employer-based plan until the parent who holds that policy retires. So, for example, I was saying that my daughter's 25. She is on her dad's plan, my husband's plan, and she's going to be turning 26 this year. We have notified them that she is a disabled adult child. And so under the Social Security Act, as a disabled adult child, she should be allowed to stay on our policy. And so you want to make sure to notify them of that well in advance of that 26th birthday, so that they can stay on your plan into adulthood and through that employed parents or guardians retirement when they go on to Medicare themselves. So just wanted to make parents aware of that as well.
And how do you get them to be declared a disabled adult child? Is that, if you get guardianship, does that automatically give them that title?
Every employer has their own process, which makes
Okay.
it fun. Yeah.
Okay.
We can't just have a uniform process. That would
Okay,
be
why
too
not?
simple. Why would we do that? Yeah. So unfortunately, every employer has their own process. They should be fairly similar. They may call them different things, but you'll want to talk to your employer, talk to your human resources department, say, I have an adult child who has a disability. They are dependent on me. There'll be some criteria for them to meet. Like you have to show that they are not self-supporting, and guardianship certainly helps show that.
Right.
So you basically just get the process from your employer. We notified our employer when my daughter turned 18, just to be safe. And we kind of re-notify them every year just to be safe. But you'll want to definitely do it well in advance of their 26th birthday, just so you don't have any problems. Just get their process and follow it. Basically,
I didn't know that, so that's really good to know that they can still, after 26, be on your insurance.
Yes,
that's great.
Most plans. There are a few exceptions here and there, but most plans will allow that. Most employers will allow that.
That's good.
Yeah, so you'll definitely want to, if your child I would say if your child is 18 or older, ask about it now, because life happens, and you definitely don't want your child going without health insurance, even for, we're all one car accident away from disaster in terms of health insurance or, medical bills. So, so just ask about it, and then just follow their procedure, and, you should be good to go. So definitely keep that in mind. And then these are just some of the other things that the Affordable Care Act has done for the autism community that has really been beneficial, and that are actually very popular with the American population. I think Obamacare kind of became a political football and kind of got a bad name. And was it a perfect law? No. Was it passed perfectly? No. The way the sausage is made is always ugly. But politics aside, there were some really big benefits for our loved ones and really big benefits for the population in general. If you love someone with cancer, or you love someone with diabetes, or you love someone with heart disease, or you love someone with multiple sclerosis or any chronic condition, all of these things I have on this slide here, those were all things that came with the Affordable Care Act. And now people who have chronic conditions, whatever they may be, or have cancer, or have something that is expensive to treat, they have so many more options now than ever before, and don't necessarily have to go into bankruptcy to keep their health. So I feel like that's huge. And, so I think we as a country can do a better job of protecting each other. And is this perfect? No. But did it add a lot to help our neighbors? It did. It really did. So, so there's that. And preventive care, huge. Used to have to pay out of pocket for a lot of that. And now that is covered because of the Affordable Care Act. So, and that's just a benefit for everybody. Now, mental health parity law, talked about that a little bit already. Want to talk about it a little bit more. And Kelly, help me watch my time, because I actually have nothing with me. I'm not sure why I'm doing this. I have nothing with me to tell the time right now. So
we have 10 more minutes till it's 1 o'clock.
Perfect.
How about that?
We'll talk about mental health for a few minutes, and then
there you go.
So mental health parity law, huge law, very complicated. I'm going to try to just distill it down to a couple nuggets. Basically, in a nutshell, if an employer offers mental health coverage, that coverage cannot be worse than the coverage they offer for physical conditions. And so, for example, if they cover outpatient therapy for if you break your leg, then they can't say, well, you can't have outpatient therapy for depression. They have to cover both, if that makes sense. There's some technical terms in here that is kind of getting into the weeds, but the basic message of mental health parity law is that insurers should stop discriminating against people who have mental health needs, and should be offering coverage for mental health conditions that are basically on par with what they are offering for physical health conditions. Because honestly, our minds and our bodies are connected. We can't disconnect them, and whatever happens to our bodies affects our minds. Whatever happens to our minds affects our bodies. We know that. It makes no sense that we've ever divided these two things, but we did, basically for the purposes of kind of carving people out of health insurance coverage. So this law is reversing that trend and trying to get our insurers back to treating people like whole people, and recognizing the reality that mental health and bodily health really cannot be disconnected. So they should not be treated so differently that there's discrimination happening, is kind of the bottom line message for mental health parity. So that's the goal of mental health parity. But as you can imagine, it's so ingrained in our system to treat mental health differently, and in a way treat mental health as not as healthcare, which makes no sense to me, but that's kind of how the system was set up for decades and decades. So turning that around is taking time. So there's been some litigation about it. There's ongoing advocacy, and just on people's personal basis and on a national basis, to get better enforcement of this law. It's over 10 years old, but a lot of insurers are still not complying with it because it's just not as well understood as it should be. So just because your insurance company says no to a treatment doesn't necessarily mean that it should be no. And so don't be afraid to appeal denials of services, especially for autism and mental health coverage, because if you're covered under federal mental health parity law, that denial might not be what it's supposed to be. There may be good reasons to overturn that. Some states have already taken this litigation against United Behavioral Health and made it into law, basically saying that an insurance company cannot deny any mental health services that have been determined to be medically necessary by these medical societies that are non-for-profit and have come up with clinical guidelines based on what is clinically appropriate, not based on what's cheaper or what is, kind of the minimum of what could be done for these different conditions. So we're keeping an eye on that, and keeping an eye on that advocacy and those developments as well. This litigation is currently under appeal, so we're keeping an eye on that. Talked a little bit about keeping your adult child on your health plan. These are just some of those kind of magic phrases or keywords that you'll want to use to ask your employer about if that's an option for your family. And it, like I said, it is available in most states and with most plans, but there will be exceptions here or there. So you'll definitely want to ask human resources with enough time to get all the documentation together that you need and to investigate other options if you happen to be in one of those exceptions there. So any questions on that? Okay. And then last but not least, there are some links to some of the resources that the ARC of Indiana has on our website to do a little bit deeper dive. I know this was kind of a quick overview of many things insurance, but if you want to get deeper into something and do a little bit more research, here are some links to some of the things that we have on the ARC of Indiana's website. And also then our website and my email. And then this is also the phone numbers for the ARC of Indiana's central office. We have advocates across the state who are available to answer questions, and they're very happy to help, and they are all part of the disability community, either themselves or through their family members that they love. And so they're not only talking the talk, they're walking the walk as well. And so they are happy to help and collaborate with families and with other organizations to get good information out to the community and help solve issues. So with that, I will just say thank you, Kelly, and thank you to everybody watching. And if you have any other questions, I'll certainly answer what I can, and what I can't, I'll try and figure it out.
I appreciate Michelle. This is a great presentation, great information. I even learned a few things, which is amazing. And we will be sharing your information with everybody and the link. So thank you very much. And we hope everyone has a great day.
Thank you.